There is an entire economy that only exists because American healthcare is broken. And the terrifying part, it now employs more people than the US military, the auto industry, and every public school teacher in the country combined. And if we ever actually fixed healthcare, every single one of those jobs disappears. Everyone knows American healthcare is expensive. You've heard the statistics. You've seen the bills. You've probably watched someone you know avoid going to the doctor because of what it might cost. That part isn't a secret, but here's what most people don't fully appreciate. The dysfunction in American healthcare isn't just a side effect of a flawed system. For a very large number of people and organizations, the dysfunction is the product. There is a hidden economy worth trillions of dollars that has been quietly constructed on top of the act of treating sick people. And this economy doesn't just benefit from the broken system. It actively depends on it. It lobbies for it. It hires lawyers to protect it. And it has become so deeply embedded in the American economy that removing it now would be one of the most disruptive events in modern financial history. Today, we're going to follow the money. Not just to identify villains, though there are a few, but to understand the interlocking incentives that have turned something as simple as seeing a doctor into one of the most economically complex transactions a person can make. Let's start with a number, 18%. That is the share of the United States GDP currently consumed by the healthcare sector. To put that in context, the entire US manufacturing industry, cars, planes, steel, semiconductors, accounts for about 11% of GDP. Healthcare is bigger, by a lot. Now, most developed countries spend somewhere between 9 and 12% of their economy on healthcare. Some, like Japan and the UK, spend even less. And when you adjust for outcomes, life expectancy, infant mortality, preventable deaths, the countries spending less are frequently getting better results. Which raises a fairly uncomfortable question. Where exactly is all that extra money going? Because it is clearly not going into your health. The answer, it turns out, is that a very large portion of it is going into the machinery, built to manage, negotiate, process, approve, deny, audit, bill, and litigate the actual delivery of healthcare. It's going into an administrative apparatus that has grown so large, it now employs over 20 million people in the United States, even though fewer than 1 million of them are actual direct care physicians. Read that again. 20 million people. 1 million doctors. For every doctor actually treating a patient, there are roughly 19 other people whose jobs exist somewhere in the ecosystem surrounding that interaction. And almost all of them are there because the system is complicated in ways that it doesn't need to be. To understand how this happened, you have to start at the beginning of the pipeline, the doctors themselves. Becoming a physician in America is extraordinarily expensive. The median medical school graduate finishes with around $250,000 in debt. For students at private institutions, that number can reach $400,000. Factor in the years of residency where earnings are low and hours are brutal, and by the time a physician enters independent practice, they are already financially behind most of their peer group. This creates a structural expectation. American doctors need to earn a lot of money to justify the investment, and on average, they do. Physicians in the US earn almost double what comparable doctors earn in other high-income countries, including places like Switzerland and Australia, which are themselves considered expensive by global standards. Now, that's not the doctor's fault. The debt is real. The training is real. The expectation of high earnings is a rational response to a system that front-loads enormous costs onto anyone who wants to enter the profession. But here's where it gets interesting. The organization that represents American physicians, the American Medical Association, has spent decades lobbying Congress to keep the number of doctors artificially low. The funding for residency positions that train new doctors has been essentially frozen since 1997, even as the US population has added 70 million people. The result is a deliberate supply constraint that keeps physician salaries high. Meanwhile, the AMA has also pushed aggressively to expand the list of medical procedures that legally require a licensed physician, even when nurse practitioners or physician assistants could safely and competently perform the same tasks. The effect is to concentrate more billable hours inside a bottlenecked group of highly paid professionals, which drives up cost at every step of the chain. And then on top of all that, a significant portion of a physician's actual working hours aren't spent treating patients at all. They're spent filling out forms, justifying prescriptions to insurance companies, documenting procedures in formats that satisfy billing requirements rather than clinical ones. America has the highest medical administration cost per capita in the world, more than triple the second highest country, Germany. And Germany, to its credit, has made excessive paperwork basically a cultural identity. The point isn't that doctors are the villains here. Most of them became doctors because they want to help people. But the system they operate inside rewards gatekeeping over access and complexity over efficiency, and those incentives have consequences. Move one step up the chain and you run into the hospitals, which, much like the doctors inside them, have become a significant source of the problem through consolidation. Over the past 2 decades, independent hospitals and private medical practices have been steadily absorbed into large regional health systems. The number of physicians running their own independent practices has fallen sharply. In many parts of the country, a single health network now controls most or all of the available specialist care. This matters because consolidation removes the one mechanism that might otherwise put downward pressure on prices: competition. When a hospital system has a regional monopoly on, say, cardiac surgery, patients don't have a choice. They pay whatever the system charges. Insurance providers don't have much leverage either. If a hospital is the only provider of a critical service in a market, the insurer either covers that hospital or loses all the customers in that region who might need that service. Large health systems have learned to exploit this dynamic through what are sometimes called all-or-nothing contracts. The terms are roughly what they sound like. Either an insurer agrees to cover every facility in the health network, including the expensive specialty centers, or they get access to none of them. This removes the insurer's ability to build lower-cost narrow networks and forces them to include high-cost facilities whether or not their customers need them. And then hovering in the background of all of this is private equity. The Government Accountability Office has flagged the role of private equity firms in systematically acquiring regional medical practices to build local monopolies. This isn't incidental, it's a deliberate investment strategy. Buy up the independent providers in a region, consolidate them under one umbrella, and then use that market power to charge higher prices to insurers and patients. Anti-competitive behavior in healthcare gets less scrutiny than in other industries, partly because healthcare is complicated, and the regulators tasked with overseeing it don't have the specialized knowledge to effectively push back against industry groups that claim every merger improves patient outcomes. Now we get to the most visible players in this entire system. The insurance companies. Health insurers occupy a strange position in this ecosystem. They are, in many ways, caught between the same forces squeezing everyone else. They can't control what doctors charge. They can't always push back against dominant hospital systems. And they are required by regulation to cover a growing list of services. But they also have a very specific business incentive that points in entirely the wrong direction. Health insurers make money when the premiums they collect exceed the claims they pay out. From a pure financial standpoint, the ideal customer is someone who pays premiums for years and never gets sick. The ideal outcome, when a claim does come in, is to delay it, reduce it, or deny it. Now, the Affordable Care Act introduced a requirement called the medical loss ratio, which mandates that insurers spend at least 80 to 85% of premium revenue on actual healthcare. This was meant to cap profitability and reduce the incentive to deny claims. And it does, somewhat. But it also creates a perverse secondary incentive. The more total premium revenue an insurer collects, the larger the absolute dollar amount they're allowed to keep as profit, which means insurers are actually incentivized to let overall costs rise, as long as their cut stays proportional. Higher premiums equal higher profits, even if the percentage retained is capped. And of course, for most Americans, the actual cost of their insurance is hidden behind employer health plans. The employer pays a portion, the employee pays a portion, and neither of them fully confronts the total number, which means the mechanism that might normally create pressure to shop for cheaper plans, the awareness of what you're actually paying, is systematically obscured. Sitting on top of all of this is the pharmaceutical industry, which has turned the American market into something essentially without parallel anywhere in the world. US pharmaceutical companies earn roughly 40% of their total global revenue from the American market alone, a market that represents just 4% of the world's population. The reason is simple. Unlike almost every other developed country, the United States does not centrally negotiate drug prices. Insurers and pharmacy benefit managers negotiate individually with drug manufacturers, which gives manufacturers enormous pricing power, especially for drugs with no direct competitors. The result is that Americans pay anywhere from 2 to 10 times what citizens in other developed countries pay for the exact same medications, often manufactured in the same factory by the same company. What makes this particularly remarkable is that the profits generated from American sales effectively subsidize pharmaceutical R&D for the entire world. Because the US market is so lucrative, drug companies can sell into Europe, Canada, and Japan essentially at cost and still generate significant returns on their investment. Americans are, in a very real sense, funding the development of drugs that other countries then buy cheaply, while US patients continue to overpay. So now we have the full picture. Doctors with artificially constrained supply, hospitals consolidated into regional monopolies with pricing power, insurers with misaligned incentives and opaque cost structures, pharmaceutical companies using the US market as a global profit center, and woven through all of it, a vast administrative infrastructure built to manage the interactions between these groups, lawyers, auditors, billing specialists, compliance officers, lobbyists, consultants, each of whom has a job only because the system they work inside is complicated enough to require them. The healthcare sector is the single largest lobbying spender in the United States. In 2024 alone, healthcare industry groups spent close to $750 million at the federal level just to maintain the rules and regulations that keep this architecture intact. And here's the trap. If you could somehow wave a wand tomorrow and replace the US healthcare system with something equivalent to what exists in Australia, a blended public-private model with good outcomes and well-compensated doctors, You would eliminate somewhere between 7 and 12% of total US economic output. You would eliminate millions of jobs. The economic shock would be larger than the 2008 financial crisis. That isn't an argument for keeping the system broken. It's an explanation for why it hasn't been fixed. No elected official wants to preside over that kind of economic disruption, even if the long-term outcome would be far better for the country. The pain is immediate and concentrated. The benefits are diffuse and take years to materialize. But here's what's important to understand. None of this means the system can't change. It just means it can't change overnight. The good news is that incremental improvements don't require blowing everything up. Stronger antitrust enforcement against hospital consolidation would restore some competitive pressure on prices. Transparency requirements, forcing providers to publish actual prices, not just list prices, would give patients and insurers better information. Reforming the residency bottleneck would expand the physician supply and reduce the cost pressure at the top of the chain. Allowing Medicare to negotiate directly on pharmaceutical prices, which was finally partially enabled in 2022, removes at least some of the pricing asymmetry in the drug market. None of these are radical proposals. Most of them are things that other countries have been doing for decades. The obstacle isn't a lack of ideas, it's the weight of the hidden economy that benefits from the current arrangement. There is also a broader economic argument worth making. One of the most significant barriers to entrepreneurship in the United States is healthcare. Leaving a stable job to start a business means giving up your employer-sponsored insurance. For a family with any kind of pre-existing condition, that is not a hypothetical risk. It's a potentially catastrophic one. An unknown number of businesses have never been started. An unknown number of innovations have never happened because the person with the idea couldn't afford to lose their health coverage. Fixing healthcare doesn't just improve health outcomes, it unlocks economic activity that is currently being suppressed by the fear of medical bankruptcy. So the next time someone tells you American healthcare is broken, they're right. But they're also only telling you half the story. The system isn't just broken by accident or incompetence. It's broken in ways that are extraordinarily profitable to the people positioned inside it. And it remains broken because dismantling it would require accepting a short-term economic hit that no one in power is currently willing to absorb. That's not a conspiracy, it's just incentives, which, if you've been watching this channel for any length of time, you know is usually the real explanation for why the world works the way it does. If you found this video useful, make sure you subscribe, because we're just getting started on the systems that shape where your money actually goes.